thank you very much. And I will tell you that our group, Henriott Group, has been helping develop and work on this trust since 2000, and I guess at this point in time we're into the trust 4 years. So for the last 5 years or so, we've been working on this concept. And the City of Lafayette, without having the City of Lafayette involved, we would not have the IACT Medical Trust, because the City of Lafayette, along with 3 other cities and towns, were the basis for the trust that started again in 2000, January the 1st of 2010. So since 2009, we've been working on this concept. Please. I'm going to go through a little bit of a background before we get to what the mayor asked me to do, which is the banding formula, which is really the big change that happened as of January the 1st of 2013. But the mission of the trust, I want to talk about that. The mission of the trust, and we talk about this a lot, and this is exactly what we're about. The mission of the IACT Trust is to improve the well-being and quality of life of our municipal employees. And oftentimes when I'm doing these presentations, I stop right there. Because really this is all about our employees. It's all about what's happening to the employees. It's all about what's happening in the medical arena. And cities and towns are just like every other employer, public or private. Medical insurance costs are going up dramatically. They have gone up dramatically. They're going to continue to go up dramatically. With health care reform, they're going to go up even more. So there's lots of things happening with health care that are making cities and towns' budgets almost unsustainable when it comes to medical cost. As budgets become more and more constrained, but more and more cost is transferred to employees, and obviously benefits are reduced. And those are the 2 things that have been happening, and they continue to happen. They're happening, and they have continued and will continue to happen. So that in order to maintain the quality of life for our employees, municipal employees, like all other employees throughout the country, are really, the benefits are dependent upon the benefits. It's part of your compensation. It's very important. And the fewer benefits you have, the less value there is to working with any employer. So that's a really an important issue. And the trust, obviously, we want the trust to offer a financially sound, secure, stable way of providing these benefits. Now, this is the problem, and again, as we're doing overviews and presentations, this is a slide we use. But you know, health insurance costs, and for me on the Board of Works, I always, when I talk about this, I didn't realize how many engineering fees costs we pay for cities and towns. So, but this slide says that medical insurance is the 2nd largest cost most employers have, and I think that's true for public employers as well, only behind compensation. So it's a big deal, and as medical cost continues to inflate, right now medical inflation is about 12% a year. As it continues to inflate, then that becomes, obviously, the cost of insurance and the cost of these benefits continues to go up. You can see medical trend, 10 to 15%, that's absolutely correct. That's been true for a long time. And at the bottom of the page, it talks about alternatives that cities or towns have. There's really only 3 things that anybody can do. You can shop around for a better deal. That's one thing. You can look for a better option, a better mousetrap. You can change your plan design, and cities and towns typically are, as with any private employer or any employer, period, are changing benefits fairly regularly. So they're lessening benefits to help reduce the cost, and you can transfer more cost to the employees. Those are the only 3 things in the short term you can do. Now, there's a long-term strategy that we're trying to employ that I know Lafayette is doing really well with, and I'm really proud of what you all are doing, and that's to begin to focus on wellness and the demand for benefits. The welder our population is, 80% of all cost, 80% of all benefit costs is related back to, basically they would say lifestyle choices. 80% of all cost, okay? So as we begin to do a better job with wellness, that obviously is going to have an impact upon our cost at the end of the day. Thanks, Amy. Pooling, what pooling is, and I'll not spend a lot of time on this, but pooling, we have right now 19 cities and towns that have gathered together. We started with 4, we now have 19. We have 3,000 employees in the state of Indiana, about 8,000 members overall, 8,500 members overall, that are participating in the IACT Medical Trust. So the trust has been growing. It's been very well received. And what that is we have 19 cities and towns now that are pooling together their premiums and buying as a group. That's basically what pooling is. And the reason that's important is because we can do several things. First of all, as a large group, even though you're an employer of 500 or 550 or in that area, 500 to 600 employees in the city of Lafayette, you still don't have the scale to buy. to buy as well as a 3,000 group does, a 3,000 member group does. So our fixed costs are lower, the administrative costs are lower, we have a larger group that we can retain more exposure, there's a variety of things that go into this, and at the end of the day, we feel that with the IACT Medical Trust, we have the most efficient and effective way of delivering medical benefits to our employees. Pooling is being done throughout the country. It's been done for many, many years. It's a very, very proven and successful way of trying to help lower insurance costs overall. Here are our members that we have in Indiana right now. You can see from the northern to the southern part of the state. Lafayette's kind of right in the middle of that. The four original members were Lafayette, Mishawaka, Angola, and Highland. Those are the four that came together. But you can see we've added Bloomington. Other cities and towns the size of Lafayette or in that area would be Bloomington, and then we would have, obviously, Mishawaka is in that area, and Lafayette are our largest participants. Valparaiso is about 300 employees. They were just added in September of this last year. So these 19 cities and towns aggregate to have about 3,000 members overall. Now this is the trust. The purpose of the trust. People think joining the trust, well, we're going to reduce our costs. You don't reduce medical costs. When you have 12% medical inflation every year, the issue is what do you do to try to control it? What do you do to try to keep it from going up 20 and 25% a year is really the objective. Our goal is to lower the medical cost trend, which is currently, I said earlier, between 10 and 15%, but typically between 12 and 15%. And what we want to do is help affect that trend. We want to help do all we can to minimize that trend. If you think about it, let's just talk about $1 million of claims. Let's say you had $1 million of claims in 2012, and you have medical inflation of 12%. Next year, that $1 million of claims is going to be $1,120,000. That's what's happening. And the next year, that amount's going to be inflated by 12%, and then you have this exponential rise, or if you want to go this way, this exponential rise in cost. That's what happens with medical cost. Medical cost is driven, medical premiums, your premiums are driven by claims, by the claim cost that we have in the plan. So the other thing, obviously, we want to provide predictability, which is what we're getting better at. We'll talk about that in a second, and stability in a financially sound and stable environment. Now this is the actual experience. This is a very busy slide. It's difficult to really look at, but the red line we have is really medical trend. And as I said on the legend on the side, the right-hand side, this is UHC United Healthcare, which is our medical provider. This is their medical trend. This is what they use for their book of business. This is what, they don't use this. This is the result of what medical inflation is in their book of business. So you can see this last year, the medical inflation was 13%. It's averaging around 13 to 13.7% over the last 4 years that we've been in existence. So what this slide shows, the blue line is actually the aggregate average increases for all the trust. That's what the blue line is, or the blue bar is. You can see we've been below, one of the objectives is to be below medical inflation, and we're achieving that goal. Now, I'll explain a little bit more about how this works. You can see in 2013, and you're going to say, well, we had a much higher increase than a 7.5% increase. The 7.5% increase was the average for the trust going into 2013. That was the average increase. Lafayette's was above that. Lafayette's was above that because of what we'll talk about in a minute. But this is actually the experience that the trust has had over these last 4 years. This is how the premiums of the trust are calculated, and I want you to notice the largest piece of this pie is 72.5%. When we're setting the premiums, or the premium levels that are necessary for a member to join the trust or to be in the trust, the targeted loss ratio, and loss ratios are claims paid to premiums received. That's that ratio of claims paid divided by premiums received. We want that to be 72.5%. That's the average. That's our target number. Okay, that's the biggest slice of that pie. So if we have a city that's averaging lower than that, then obviously their claims are lower than what we'd expect them to be. That's 72.5%. If we have a city or town that's higher than that, then the claims are higher than what we would expect them to be, but the target is 72.5%. We add, so that's the claim component. That's our expected claims component. Because we're a multiple employer trust, the state of Indiana actually does the regulation of things that we do in the trust. The state has rules. The Department of Insurance has rules. One of the rules is we not only have to fund our premiums to what the expected claim levels are, but we have to fund our premiums to the maximum claim level, the highest claim level that actuarially we think we'll have, potentially could have. And that's the darkest slice of the pie, 72.5%, plus the 10.9% red slice of the pie. So our premiums are determined based upon maximum claim liability. Hang in here with me for a second. The next thing we add on to into the mix of the premium is the administrative cost, which is the blue slice of the pie. And when I say we have the most effective and efficient way of providing medical benefits, typically in a self-funded plan, that administrative cost is going to be between 15 and 20%. In a fully insured plan, that administrative cost is going to be between 20 and 25%. Our administrative cost to operate the plan is 8.6%, and the larger our trust gets, the lower that's going to be. Okay? So we have a very effective and efficient mechanism to deliver these services, just to make that point. And the last number is the last 8%, which is the purple slice of this pie, is what we call run-out or incurred but not reported claims. If the trust would ever be dissolved, the state of Indiana requires us to have reserves available that will pay all the claims that are incurred as they're paid out over the years. So those are the reserves we have to have. This is like operating your own mini insurance company, is what this is. So that comes together, if you add all those numbers together, that's 100% of the premiums you're contributing. That's how it's determined. Okay? Now, I knew this was going to be too small, yeah, but I can get copies for you. Be happy to send out copies of this presentation or this overview. But this is how the City of Lafayette's premiums were determined in 2013, for January the 1st, 2013. First of all, in this middle box, and I'm not going to move around a lot, but in that middle box at the top of the page, it talks about premiums paid versus claims paid, and you cannot see that, and I apologize for that. But what it says, the total is what it says at the end of the day. It says that you paid premiums of, Chris, can you read it for me? I can't even read it.
Premiums paid were $16,051,469.
$16 million in premiums we paid for the last three-year period of time. And this is as of September the 1st of 2012. And claims paid were $13,676,400. Okay. So the loss ratio for the City of Lafayette for that three-year period of time, or almost that three-year period of time, was 82.5%. 85.2%. I got the numbers back. 85.2% was our loss ratio. Now remember what I said, that our target loss ratio was 72.5%. Remember that number that I had from that previous slide? So what that means, unfortunately for the City of Lafayette, is your premiums are not high enough. One of the things, you have too many claims or your premiums are not high enough. And since we're going over basically a 30-month period of time, it's not a small slice. We're talking about a trend where we are over a longer period of time. Does that make sense? If it was only 1 year, you could say, well, we had a bad year. If it was a bad year and a half, we could say we've had a bad year and a half. If you have a 3-year period of time, we've had a bad 3-year period of time. Something probably is, we're probably not paying a premium. And unfortunately, that's the situation we find ourselves right now. So what the first step of the banding formula for the cities and towns that have been in the trust long enough, and I don't want to get into all the detail, but we have this adjustment period where if somebody is underpaying or somebody is overpaying, we have to have a true-up period, and that's at the end of the 3-year period. We have this true-up period we have. So the biggest factor in Lafayette's increase at the end of the day, which was over 17% of your premium, was this over this 3-year period of time structural adjustment that we have. That really, at the end of the day, added 5.2% more to your premium increase than because of this 3-year loss ratio issue. The bottom of the page, again, I apologize for that you can't see this, but the bottom of the page is there's the second step of the rate adjustment for all cities and towns. It's called a market-based adjustment. And what we're doing is we're saying if the City of Lafayette would go back to the marketplace, and we actually did do this in the City of Lafayette. We actually went back to the marketplace outside the trust, and we said, what can we get in the marketplace? And what this says is, according to the way the trust has calculated your premiums would be outside of the trust 32% higher than they were last year. That's what that says. At the end of the day, we were more like 28% higher It wasn't 32%, but it was more like 28% higher. So on your own, at best, which is what we found out, based upon the benefits and the structure of coverage that we currently have without making those changes of reducing benefits, which is a big deal, which is what, again, everybody's trying to do to control cost. Without doing that, your cost on your own would have been 25, 26, 28, 30% higher than what your rates were in 2012. That's how much lower your rates, how much your rates needed to go up. So at the end of the day, the 17%, what we did with this market-based adjustment is we're saying if you were only based upon the market, then you wouldn't need the trust. So what we did a blending of 70% of the trust increase, 7.5%, 70% or 30% of the Lafayette increase, and we blended those two things together, along with that one-time adjustment we made, which I know this is complicated, but it came out to a 17% increase in Lafayette's premiums. That's how we got from a 7.5% average trust increase to Lafayette having a 17% increase. Now that first adjustment that we made is done only once every 3 years. So it's not done every year. So we're out of that woods for a period of time right now. And I really do not anticipate that ever happening again for Lafayette. I don't think it will. But every year we're going to be doing the market rate adjustment, which I think is a fair way of looking at things. Let's talk about theoretically why we do this. You have, let's round off, 20 other cities and towns are in this pool. If, in Lafayette's case, if Lafayette's paying not enough premium, the 19 other cities and towns are supporting Lafayette. They're subsidizing Lafayette. Now, everybody does that once in a while, but we don't want to do that structurally over a long period of time. What it means is if Lafayette's rates are too low, that means everybody else's rates are a little bit too high. So from a fairness perspective, we have to be able to make adjustments. The other way around, too, we had one city or town that's rates were too high. And they received actually a rate reduction because over this 3-year period of time, they consistently had a loss ratio of 40%. Remember, the target loss ratio was 72.5%, and their loss ratio was 40%. So they were paying, so structurally their premiums are too high. We don't want them to leave the trust, do we? Because they're a net contributor to the trust. We want them to stay in the trust, so we have to offer them a little bit of relief. Because after a 3-year period of time, any city or town can leave the trust if they wish, after they finish that 3-year commitment. So it's important for us to keep the good guys in the boat. And it's important for us, for the folks who are not paying quite enough, to help them pay a little bit more. That's how we have to. That's how the process has to go. Now this is just general information. Here are the Board of Trustees. With the trust, when you have a medical trust or you have a trust like this, you have, rather than a Board of Directors and Directors, you have trustees. So here are the 12 trustees of the IACT Medical Trust. The first 6 are appointed by the members, the representatives of the members. The next 4 are appointed by the IACT Board of Directors, and the last 2 serve. One is Gary Malone from Umball & Associates, who's a CPA, serves as an independent financial voice on the trust, and Matt Greller, who's the executive director of the IACT Trust, serves with voice and no vote. The trust is protected by the Department of Insurance. It's regulated by the Department of Insurance. This trust that we have is basically, I don't want to lead you on to think it's actually an insurance company, but it's operated as if it were an insurance company. It's a multiple employer agreement, and we're regulated. We file quarterly financial reports. We file annual financial reports. We have audits. We have to go through the whole process that basically an insurance company would go through. We do purchase at the trust level. We do purchase reinsurance. So if we have a $1 million claim, the trust is only responsible for the first $300,000 of the claim. If we have our experience as an aggregate becomes really, really awful as a whole, then we have reinsurance that will kick in to help minimize that terrible, terrible, terrible year, which with our size will probably never happen. Now, one of the things that you all are talking about, and one of the things the mayor just mentioned in his introductory remarks, is talking about empowerment of our employees to be better consumers of health care. One of the things the trust can do, the trust can offer the participating cities and towns, are the things that we can do together better than we can do individually. So the strength in numbers idea comes into play. One of those, obviously, is bringing more services to our employees. In the IACT Medical Trust, we have disease management programs for 6 chronic issues. Okay, there are 5 mentioned here. We also have something called a healthy pregnancy program for higher risk maternity issues that's included in the trust. But here are asthma, diabetes, coronary artery disease, heart failure, and healthy back. Out of these chronic conditions, these typically, what they call chronic conditions, means they're reoccurring. That once you have coronary artery disease, you have coronary artery disease. You can get better, you can manage that, but that's a disease it's a chronic illness you have to manage. If you're a diabetic, you have to manage your diabetes. Okay, if you're an asthmatic, you have asthma. If you have a back problem, for those of you who've had back problems, Brad, you know what? You always have. You're always going to be concerned about your back program, and trying to take care of your back. So, of these diseases up here, these diseases would amount to probably half of your cost. Probably half of Lafayette's medical cost is caught up in these diseases, in the cost of managing these diseases. And of that half of your cost, of that 50% of your cost, about 2% of your population is driving annually those claims. Very small number of people are having very severe losses. All right? And that's just typical. We're talking about average. If you're diabetic, maybe we have diabetics in the room, but if you're diabetic, 9% of your population is diabetic. 9% on average of your population is diabetic. The scary part about that is there's another 25% of your population is pre-diabetic. If they don't change, if something's not done, they're on their way to diabetes. Okay? So it could be, we have, from a diabetic perspective, we could have 34, 35% of our population that's either diabetic or on the way to diabetes. So we have ways of helping manage that. We have intensive ways of helping manage those chronic diseases. And therefore, if we manage diabetes, if we make sure the people are doing what they need to do to manage their diabetic conditions, then the diabetes won't manifest itself in negative ways with emergency room visits and high-cost treatments. Now, just for instance, the reason we choose these things is because there's another statistic that with a diabetic, it's 9 times more expensive to treat any condition a diabetic has than a non-diabetic. That's an average. So if a diabetic breaks their leg, that's going to be, on an average, that's going to be 9 times more expensive to treat that diabetic because of the complications that go in with anything that happens to a diabetic. So the more people we can keep who are in pre-diabetic conditions, we can keep them from moving diabetes, the better off we're going to be. The more diabetics, I'm picking on diabetics here, but the more diabetics that have that condition and we can make sure they're doing what they're supposed to do to manage their diabetes, the better off we're going to be from a cost perspective. I know I'm preaching to the choir, but that's true with every one of these conditions up here. That's why we try to manage these conditions. That's why we're trying to do it together. The more empowered your employees and their dependents are about these conditions and what they need to do, when we're talking about reaching out with these types of chronic conditions, this is all voluntary. The employee doesn't have to return a phone call. The employee doesn't have to do anything. But it's obviously, we think it's in their enlightened self-interest to understand why that call's coming in or why they're receiving that email, why they need to make sure they have that annual exam. These are all really important issues, and the more we can empower our employees and engage them in that process, the better off we're going to be. The more we can provide wellness issues and keeping healthy people healthy, the better off we're going to be. So preventative benefits, all our people you have available to you, 24/7 nurse hotline. So you don't have to run to urgent care. If you have a problem, if you have a child that you're concerned about, make a phone call. The first avenue, rather than going to urgent care or going to the emergency room, is you can make a phone call. So you have, these are tools that are accessible to you right now and to your employees right now without question. Nurse hotline. We have premium designated programs, case management services. When we have somebody that has a severe program or is in the middle of a claim, they're going to have a full-time case manager that's going to be working with them to help. When I say full-time, they're going to have a case manager assigned to that case that helps them manage those costs and helps them figure out what to do. The medical service team, or the service team for the IACT Medical Trust consists of really 5 different components. One is IACT, and Cotton Gimlet IACT is the Director of Trust Operations, Henriott Group, our company. We're doing the marketing, we're helping with implementation, we're doing employee meetings, those types of things you would expect us to do. Claims resolution, we help with those types of issues if anybody has any concerns. And then we have United Healthcare, obviously, which is our network and provider. They administer our claims and they provide our network services and a lot of other things. Our attorneys, Bose McKinney Evans and Nyhart Consulting is our consulting actuarial firm. Now here are a couple things, and I know your folks have heard this, but I don't think you can hear these things too often. And I'm just going to give you, this is just a little snippet of the information that's offered by United Healthcare that your employees, we would love to see your employees engaged, understand, and take advantage of. One would be the cost of the treatment cost estimator. One of the problems with a health savings account with high deductible, what we call consumer-driven health care, is the fact there's not much transparency. The mayor is a perfect example of this when you had your, I think, MRI or colonoscopy or whatever you had, that shopping around for these different services. There's a huge disparity in treatment cost. Depends on a variety of things, but there's huge disparity of treatment cost. The treatment cost estimator that United Healthcare has out there, if you're thinking about having any procedure done, you can go out and you can look up the costs with the provider, whether it's the hospital, the doctor, you can look up those costs and you can know what they're going to cost. This is also going to tell you how your health plan will respond, what the health plan will pay for and what you'll be responsible for. Okay? So the treatment cost estimator is a wonderful tool that our employees can shop around. You can say, I need this service, where do I go? You can look at Indianapolis, you can look at Lafayette, you can do whatever you can go wherever you want to within the United Healthcare Network and get this information. It's a terrific service, and it helps to provide transparency to the cost of these services. The other thing we have is called the Premium Designation Program, which has to do with physicians and healthcare facilities. UHC is rating. You can go out on My UHC right now, and your employees can, and you can look at, on My UHC, you can look up your doctor, and your doctor will either have a no-star, 1-star, or 2-star rating. The first star that a doctor gets under this UHC system is the quality star. The most important thing about healthcare and the controlling healthcare cost is quality. For every day this is a national number. For every day you're hospitalized, there's a 6% chance of infection. Every day, if you're hospitalized for 3 days, there's an 18% chance of infection on average. For every 6 discharges from the hospital, there's 1 readmission. 1/6 of all people that are discharged from hospitals are readmitted because they're not following medication, they're not able to take care of themselves at home, and whatever the reason may be, those things add terrific amounts of cost to our system. So quality is the most important thing about healthcare. So the first star that a doctor gets is the quality. The second star is the lean or efficiency star, the cost star. A 2-star physician, United Healthcare will tell you actuarially that a 2-star physician has 10 to 15% lower cost than a no-star physician. It's huge. So if we want to know how we begin to control our costs, control the quality of our care, control cost overall, utilizing some of these services is important. Personal health support, again, these are all parts of things we just talked about, the disease management program. But again, what we want to do, and what I think you guys are really doing a terrific job of with your health fairs and the things we're doing, is making sure people understand, first of all, the conditions they have, if they have any. So we want to diagnose them early. The earlier the better, because that's when we can have the most effect and lower the cost of the program and improve the outcome. And then the other things you're doing with wellness and participating in moving and diet and eating, exercise, those types of things are all integral as far as being important to what we're doing. The Healthy Back Program, we talked about that. This is actually, in the trust, is the largest area of the soft tissue issues, strains, the shoulders, the backs, the knees. This is the largest cost that we have in the IACT Medical Trust. And that's not atypical, that's pretty typical. And then the other IACT Medical Trust offerings, Cindy's involved with the Wellness Committee, so Cindy's been involved and integral in that, and that Wellness Committee is really doing a good job looking at alternatives and trying to figure out how we really do these types of things we've just been talking about. The dental vision programs, the American Fidelity programs, which are what we call payroll deduction programs for different types of benefits you can have, are offered through the program as well.